about this time, we also started using the Chinese syrup. We had the patient import a preparation from China or Hong Kong. And the way we did it, because we didn't really have any funding, so I said, well, we got to do a quasi-study. So the first 100 patients we gave to, okay, about 52% of these patients responded. The next 114 patients I did not treat. So I waited 3 to 6 months. And then only 7 out of the 114 improved on their own without treatment. So these are consecutive patients. We did not exclude anyone. Anybody who dropped out after taking one pill is considered a failure. Okay? So it's intent to treat analysis. The difference was statistically significant. Let's go down to here. Then initially, we're just treating these patients about 3 months or so. Then we learned very quickly. After they stopped, the patient relapsed very quickly. Okay? So they were better, but then they got worse afterwards. Most of the patients went back on it, improved. Now we have given this to 366 patients, and it's still about 52%. And these patients responded to oxymatrine. And also, I forgot to mention this. So out of the 114 patients on this control group, 104 patients, we gave the same oxymatrine. We came up with about 52%. These are examples of how these patients responded. So you get an idea of what happened. Some patients did not respond at all. As you know, 50% of the patients did not respond. Some had mild responses, and these are the dramatic examples. So one guy is 59 years old. He had 2 back-to-back infections, respiratory and gastrointestinal infection, and then developed severe CFS. He was bedridden for 18 months, couldn't work at all. He had epigastric and right lower quadrant tenderness. His enterovirus serologies were negative, but we found the viral protein in the stomach biopsy, actually quite a bit of it. So he took oxymatrine for 2.5 months, and nothing happened. Then all of a sudden, he started having fevers for 4 to 5 days. This gentleman could not do anything except taking his son to school in the car. The rest of the time, he's housebound. He couldn't do anything, okay? So he had no exposure to any sick people. His wife and children were not sick. So he had fevers for 4 or 5 days, and his body aches were a little better. It meant he had some mental clarity. Then the next 10 days, he took this Chinese syrup, no more fevers. In the next 2 months, he went back to work full-time, and it's been 3 years in remission. It's interesting that when I saw him, every time I see him, he still has a little bit of this right lower quadrant tenderness, suggesting that there might be something still there, but his immune response is much better in guarding it. The second patient is a 25-year-old female with ME/CFS for 5 years. Energy levels about 3 to 4 out of a 10, diffuse myalgia, cognitive function, et cetera, et cetera. The coxsackievirus antibody was greater than 1 to 640 repeatedly. So because she had a lot of pain, which I think is inflammatory response, these patients don't tolerate high doses very well. So I said, why don't you just take 1 tablet a day and see what happens? I expect you to have some increase in symptoms in the beginning. Well, she did have that for about a week. Then gradually over the next 10 days, the body ache disappeared completely. The next week, she went out jogging 3 times a week. It's pretty amazing. So she felt pretty normal in 2 months, and she said, well, I feel normal, why don't we just stop it? Okay, she stopped. 2 months later, all the symptoms came back. It's very hard to get rid of these guys, okay? That's one thing that I always know in this type of illness is relapses. This is no different from hepatitis B or HIV. If you treat the patient with good drugs, antiviral drugs, you stop too soon, or in HIV case, you can't really stop. The virus will come right back. This is an interesting patient that actually had a very nice response. She was a marathon runner before, became ill with a respiratory gastrointestinal infection, flu-like symptoms, while training for the race. So she didn't make it through the race. She almost died, she said. But she was bedridden for the next 2 years after the race, able to set up, do business on the phone or the computer for 1 to 2 hours. She's basically housebound, couldn't do anything else. She took the Chinese syrup 3 times a day, had an initial increase in headache, body aches, gastrointestinal symptoms for 2 weeks. They felt pretty normal by 3 months. She sat there and she said, I feel normal, okay? And I was dumb enough to say, well, why don't we just stop and see what happens? So within 36 hours, she had a marked increase of all the pre-existing symptoms. It was even worse before she took the herb. And it's interesting now, before she was taking 6 a day, she couldn't even tolerate a half a tablet now. The pain would get so much worse, okay? 6 weeks later, she said, I have to get back to that state. This has not happened to me for 2 years, okay? I want to try something. So I put her on a half dose of interferon, this is called Pegasus, every week. Then about 2 days, I told her to go back on the Chinese syrup. In the next 3 weeks, she actually worked up to 6 per day. By the end of the 3 weeks, the body ache went away completely. She was on the combination for 6 months, then we're on the Chinese syrup for another 18 months. So total treatment was about 27 months. She's been off for more than 8 months. She only has mild symptoms, 1 day out of a month. It's exactly the same symptoms she had before. This is always before her periods, okay? It's telling you this isn't gone yet, but it's much better controlled. So when we did the cytokine gene studies, this is IL-12, P35 plus P40 using the relative ratio of the gene expression over IL-10. All the top 7 patients responded by shift into the Th1 direction, okay? Had a 2-fold increase. My son, I think, is the second one or the third one. All the 10 non-responders did not change at all. So there is some indication that there is some cytokine gene changes. The side effects are basically increase in all the pre-existing symptoms. If you have to go through a fight, instead of using ineffective weapons, you're shifting the immune response toward the more effective immune response, then you have to fight another battle. So a number of the patients will have increased body aches, headaches, abdominal pain, nausea, diarrhea, fatigue, whatever they already had before. Some patients with interstitial cystitis, the bladder symptoms can get a little worse, dizziness, insomnia. A couple of patients compounded weight gain, they feel more hungry taking the herb. 1 or 2 patients had increase in swelling, but they already had before. Joint pains. 1 patient out of 500 actually developed rheumatoid arthritis while taking the immune booster. She has a very strong family history of rheumatoid arthritis, was having severe joint pain even before the herbal treatment, and now she's on treatment for rheumatoid arthritis. She's doing fine. 2 patients had transient increase in blood pressure, rashes, dry eyes, mouth, and it's interesting that we had 2 patients that took this for about 2 months and just continued to have headaches and no improvement. So instead of tapering off the Chinese herb, they abruptly stopped it. In the next 24 hours, the patient had a huge herpes outbreak. Herpes 1 in one, herpes 2 in another one, which they have not had for a long time. So maybe the mechanism of action is correct. Maybe we're trying to shift the immune response over, but it's almost like spring-loaded. And when you stop abruptly, it will go back down, and maybe even worse. This is a product that my son and I actually formulated, because to get this Oxymatrine from Hong Kong, it was a little bit tedious. So we formulated it, had one of the American companies make it. This was done under the good manufacturer practice. So we used this in over 134 patients, and it had about a 56% response rate. But maybe I'm a little bit better in picking the patients. The patients who have severe pains, I usually don't start them on this. People are just fatigued. This is not a bad thing to try. 88% of 51 patients actually switch from Oxymatrine to Equilibrant and have continued improvement. Other patients may have some minor issues, so they rather take the regular Chinese herb. This is better tolerated. Part of it may be because we started the dose much slower. And typically, we start with 1 tablet a day for a week to 2 weeks, and then gradually increase to 4 to 6 per day. My son and I basically took 6 a day to start with, and the increase of pre-existing symptoms is still quite common. This is an interesting patient. This is the second out of 500 patients who took the Chinese syrup. This one was on Equilibrant. This is a 13-year-old child, actually has ME, CFS, and pronounced gastrointestinal symptoms. By the time he saw me, he is already on nutrition by vein because he lost 30 pounds, he couldn't eat. And his stomach biopsy was markedly positive for enterovirus. His antibody tests actually were negative. So when I look at his T cells, the T3, T4, T8, they're all below normal. So when the patient took the Equilibrant, about 2 months, the number all went up. Interesting enough, another 2 weeks later, he actually was hospitalized because he had fevers for 4 days, just like the one I showed you before. And they thought he actually had a line infection, for giving the intravenous nutrition. Actually, there was absolutely no evidence for line infection. So I repeated his T cell count as he was hospitalized. You can see the T3 went out even more. This is when he had fevers. And actually, the CD8 increased out of proportion to CD4. Actually, almost met here. And then 2 weeks later, we measured again, kind of dropped down to about the 2-month mark. He's feeling much better. We don't know what his outcome is because it's still early. This only happened about 6 or 7 weeks ago. We have some evidence, about 5, 6 patients now. We've done stomach biopsies before the treatment and also during treatment or after treatment. So this is one good example of a patient who could not work, actually has a lot of stomach complaints. So we did a biopsy right before the treatment. She has 2 pieces of stomach biopsy look like this. You can see all these brown spots. It's just loaded with virus. This is 100x magnification, 400x magnification. One piece has some brown spots. This piece is negative. After treatment, 2 pieces look like this. This is the 100x magnification. This is the 400. You compare this one and this one. It's night and day. There's a marked reduction of the viral protein. And the 2 pieces were negative. Excuse me. The reason we do 4 pieces of biopsies is that there's sampling error. So if you just take one, you're going to miss it. So 4 pieces is probably the best thing to do. The next thing that we're thinking about is that obviously this Chinese herb does help patients, but we need something better. Just like Nora talked about in the heart infections, we believe that there is this double-stranded RNA in the cells. And these double-stranded RNA can open up into the positive and the minus strand, and these can multiply using a viral enzyme to make more of themselves. Part of it is being degraded. It's like a race. This is keep making it, our body keep destroying it. But unfortunately, in chronic diseases, they're always winning, aren't they? Right? Because once they die, there shouldn't be any more chronic diseases. So, but enough of these will recombine into this double strand. These are almost like what we call the seeds of weeds. Okay? It's kind of hard to kill them. But there's mechanisms we can actually attack. For instance, the enzymes that multiply the genes. Some of the viral gene is made into viral protein, which you can show by the immunoproxy test. Some defective viruses does come out, like Dr. Chapman discussed, and we also found in the stomach. But all this process going on inside the cell does elicit an immune response. But the immune response, one of which is the neutralizing antibodies, which we can measure in the blood. This is a paradox I finally figured out, because I said, why is there a persistent virus infection when there's so much neutralizing antibody in the blood? The antibody should neutralize any viruses, right? Well, not when they're in the cell, inside the cell. If they're hiding inside the cells, we can't touch it. So, but the viral protein being produced is triggering all this neutralizing antibody, which allow us to diagnose this disease by looking at these antibody levels. Some of this can trigger interferons. Interferons can turn on this system just as Ampligen can turn on. And this will try to degrade this, but eventually the patient with ME/CFS is still losing until we can effectively interrupt these mechanisms.